if you have the buyer that wants the price to go up and the seller that wants the price to go up, guess what? The price is going to go up.
What is fundamentally broken in the traditional insurance model?
A lot of people understand the hospital system. That makes sense. But few people understand actually
How would you explain the idea of community-based health funding in layman's terms?
If you can pay your doctor directly as opposed to paying through insurance, you can get way better rates for these services. So we're trying to do a lot of things to educate our members on how to live healthier lifestyles.
Do you think this could become the norm, this type of model?
I think the big thing here is there is such a big delta between what health insurance plans pay and what our members pay.
Welcome to Healthcare Journeys. I am your host, Kevin Rosenquist. Thanks for being here today. You know, traditional health insurance is one of the most expensive and frustrating aspects of the American healthcare system. And it's not just patients who feel the pain. My guest today is Andy Schoonover, founder and CEO of CrowdHealth, a company that's disrupting the industry with a community-based approach to paying medical bills. Andy, welcome. Thanks so much for joining me.
Hey, man. Good to be here. Thanks for having me.
What a great concept. I mentioned in our little pregame when we were talking that I don't like health insurance companies, so I'm excited to hear.
Neither do I.
Yeah, I imagine you don't. If you got this far, yeah. Health insurance premiums keep going up. We all know that. Mm-hmm. Satisfaction keeps falling. What is fundamentally broken in the traditional insurance model?
Yeah, man, so many people come to me like, man, this healthcare is so complex. I don't understand it. And what I tell them is it's not that complex. It's what we have here is we have the buyers of healthcare, which are health insurance companies, and the sellers of healthcare, which are these big hospital systems. And they both want the price to go up. And so if you have the buyer that wants the price to go up and the seller that wants the price to go up, guess what? The price is going to go up. And so a lot of people understand the hospital system. That makes sense. They want as much for their services as possible, but few people understand actually the insurance side actually wants prices to go up too. There's a law that requires health insurance companies to only profit 15% of your premiums. So if you have $1,000 of premium and you have 15% of that is $150. So they're maxed out at $150 that they can profit from your $1,000 premium. Well, the problem with that is that these companies want to make more money year over year. They want to see their profits grow. And so guess what? What do they have to do to get their profits from $150 and grow it 10% to $165? Well, your premiums have to go from $1,000 to $1,100. Mm-hmm. So they actually have an incentive to see premiums to go up over time, which means they have an incentive to have you sick. They have an incentive for these hospital prices to go up. And so there's no, counteractive forces that are pushing healthcare prices down. Because as I said, the buyers want the price to go up and the sellers want the price to go up. So that's why our healthcare system is so expensive and so wonky. It's these perverse incentives that are really driving these prices higher.
Mm-hmm. Yeah. And for listeners unfamiliar with how CrowdHealth works, how would you explain the idea of community-based health funding in layman's terms?
Yeah, I'll give you if you don't mind, a little bit of context for how I got here, because I would
actually, that was my next question is how you came about this. So let's go.
A little bit of an understanding about why I'm doing this crazy thing. This is my second healthcare company. I sold my first company, and as a result, I didn't have health insurance because most of us get health insurance through our employer. And so I went to the Affordable Care Act, the marketplace. Some people call it Obamacare, whatever you want to call it. But I went to that marketplace to buy a plan, and I got one for me, my wife, and my two girls. And I kind of joke, it worked until I had to pay for it. Until I had to use it, excuse me. Mm-hmm. My little one was one at the time, and she was having a recurring ear infection. So we went to the ear, nose, and throat doctor, who said, she's got a hole in her eardrum. In essence, what was happening is the fluid was building up in her ears to the extent that it popped her eardrum. And so he's like, no big deal. We just have to get, tubes in her ears. It's a 15-minute procedure. It's super easy. There's a place to do it in network. And we're like, great. So we went and did it and got the bill 3 or 4 weeks later, and it was $8,000 for a 15-minute procedure. I'm just like, holy crap, $8,000 for 15 minutes. But this is what health insurance is for. Like, this is the whole point of health insurance. Little did I know I was going to get another note in the mail 3 or 4 weeks after that from my health insurance company, who said it was medically unnecessary, and so they weren't going to pay for it. And so I had to go through 2 rounds of appeals process, and they were like, nope, we're not paying for it. So I had to stroke an $8,000 check to the local hospital. And as you can probably imagine, I was pissed. And yep. I called my health insurance plan. I was like, I quit. Like, I'm not doing this anymore. I'm over this health insurance game that y'all are playing. And so in essence, what we did was became uninsured. And over the next 12 months, I realized that if you can pay your doctor directly, as opposed to paying through insurance, you can get way better rates for these services. I realized that I could have negotiated with the hospital. Didn't know that before. Yeah. So I started learning all of these things and realized, you know what, I bet you other people would want access to these tools too. And so we started CrowdHealth in April of 2021. So we just celebrated our 4th birthday, I guess 2 or 3 weeks ago. So that's kind of the what led me to this. Now, in terms of like, how does it actually work? Over the last 4 years, we've gathered 10,000 people in our community who are all funding each other's healthcare needs. So if Kevin breaks his arm, it's $5,000. We ask Kevin to front the first 500 of that, and then we will send 45 people a request for $100 each. And if they say yes, then $100 will go from their account to Kevin's account. And at the end of the day, when 45 people in the community help, Kevin now has $5,000 to go and pay for his broken arm. The question is obviously like, oh, why would somebody help Kevin? Because I don't know.
Hey,
Kevin.
I'm pretty cool.
He's cool, but the broken arm is not really like a heart tugger, right?
Yeah.
But what happens is when Kevin submits his request to the community, we see the last 10 times that Kevin has been asked, and has he helped the community? Yes, or has he declined to help? And if he said yes, then Kevin's a good member of the community. And so 100% of the time when a good member of the community asks for funds, they get funded. Now, only 10% of the time, bad members of the community, people who are only takers and not givers, are funded. And so this creates kind of an incentive system to help good members of the community and not help bad members of the community. And that's what kind of the engine that drives this. And, so far we've had 20,000 bills. 99.9% of them have gotten funded. Every bill over $1,000 has gotten funded. And we've done everything from little pediatric, visits to a couple dozen, 2 or 3 dozen cancer cases now. We had a guy accidentally shoot himself, and that bill was almost $1 million. We've had all kinds of brain surgeries, heart surgeries, and this works really, really well. So that's a little bit of a background on how it works.
So when I was on your website, there's a place you can sign up and you can choose whether you want to be a $500 member or a $15,000.
Yeah, that's member. New as of Friday.
Oh, is it really? Okay. Yeah. Can you explain what that means?
Yeah, sure. So as I gave your example where you broke your arm, and if you would have chosen the $500 example or the $500 option, you'll pay the first $500 of any health event. So if you break your arm or you go to the ER or you have cancer, all of those things are called health events. And so you will pay the first $500 of that health event. And then anything after that, we will send to the community to fund. We have a second option, which we're calling the Black Swan option. Black swans, which means very, very rare in nature. And so it's, you pay the first $15,000 of any health event. And the community will then help with any bill above $15,000. So if you have cancer and you have a surgery and you have labs and you have doctor visits and you have, chemotherapy, that's all considered one health event. So if you're in the $500 option, you'll send everything above $500 to the crowd. If you're in the $15,000 option, you'll pay the first $15,000 and you'll send everything else to the crowd. Of course, the $15,000 option is less on a monthly basis than the $500 option. And so we just provide people with two different options that they can use, just depending upon their lifestyle and their desires.
So you said the monthly premium, it's like there is a premium to it that you pay a monthly fee to be a member. When you get asked for that, $100 like you were talking about for Kevin's broken arm, if it was Andy's broken arm and Kevin gets asked for $100, is that in addition to what I pay every month, or is that something that comes out of that pool, so to speak?
Yeah. So the payment is twofold. One is, I'm just going to use a single individual to make the math easy. Every month you pay CrowdHealth $55, and that goes directly to us, and that is used to pay our bills,
Sure.
to keep the lights on. And then on top of that, we will ask you to help another member in the community for up to $140. And so if a member of the community, Kevin breaks his arm, we'll ask you up to $140 to help Kevin. So the max in any 1 month that we will ask is $195. Now,
Okay.
I say max because we will only ask for what the community needs. So for example, this month, we're only asking for $85 of that $140, which means the extra $55 you get to keep. We're not asking you for it. We'll never ask you for it again. Go buy a ribeye. Do whatever you want with it.
Sounds good. I'd
So
do that.
we will, and which is cool because, in the health insurance world, if the community does really well, actually the health insurance company profits.
Right.
In this scenario, if the community does really, really well, then you actually profit. So it's better for the consumers in this case. And it incentivizes people to, behaviorally act a little bit differently if they know they're gonna benefit from the community doing really well.
Interesting. Okay, that makes sense.
Yeah.
Obviously, it's a heck of a lot cheaper than I pay for health insurance every month for me and my wife and my son. So that's remarkably less.
Yeah. So your wife and your son, you would pay 55 times 3. So that would be, what is that?
60?
65.
65?
165.
That's
that
not
165 would go directly to us.
Right.
And then you would help another member in the community for up to $420.
Mm-hmm.
So you're basically maxed out at $585 per month for you, your wife, and your child.
That's
about however, interestingly, instead of that $420 that we were asking you for, we're actually only asking that for like $240 this month, or excuse me, $265 this month.
Mm-hmm.
And so you'd have $265. This math would get harder. Plus your $165 is what, $430 or something. That would be your total for this month. So just to give you a sense, I went on the Affordable Care Act and just looked for me and my family, and I think we were like $1,300 a month, and then a $14,000 deductible.
Yeah,
which means I'm paying in $30,000 before the health insurance plan pays $1.
Mm-hmm.
With CrowdHealth, my family, I have a family of 4. We're maxed out, I think, at $660 every month, and then I only have to pay the first $500 of any health event. So It is, my family saved $20,000 last year using CrowdHealth.
I bet.
Yeah.
Yeah, and because like even if you go, obviously if I go to the doctor and it costs $180, that just comes out of my pocket because I don't meet that $500 threshold, which makes sense. But then you have to think about what you're not spending on a monthly premium, and then all of a sudden you're like, oh, I like this math. This math is good for me.
Yeah, in essence, you get all that money back, so you can spend it whatever way you want to spend it, right? And that's, if you want to go and do something that's not eligible for funding by CrowdHealth, or you want to do something cosmetic or whatever, you've got the dollars to do it. And in reality, what we're trying to do is put as much money in your pocket so you can make decisions as an individual. One caveat to what we've been talking about, we do think that preventative is really important.
Sure.
And so we do allow people, instead of that $500, initial commitment for a preventative visit, we allow everybody to go and do a preventative visit every year up to $300. So if your kid wants to go to a pediatrician and get the wellness checkup, or your wife wants to go to the gynecologist, or you want to get your labs done or whatever, you get one preventative visit up to $300 per year that's fully eligible for funding. So that's one kind of caveat to that $500. The other thing that we're doing too, which I think is interesting, especially for the listeners, is we do DEXA scans, we do fasting insulin tests, we're doing a gut health check. So we have these kind of quarterly specials every quarter that you can say, hey, go get a DEXA scan and it's fully eligible this quarter, or get your a gut health check this quarter, or get a coronary artery calcium score check this quarter. And so we have kind of quarterly specials that are fully eligible for funding. But in essence, we're doing that so that people can learn about how their body works and the metrics they need to be paying attention to and things like that, because we're ultimately trying to get people to be, not just get lower prices, but be healthier.
Yeah, and that's another thing that's a problem with traditional health insurance is there's really no incentive for preventative care.
Yeah.
I mean, it's crazy when you go and you get a bill for what you think you're doing something good that's the health insurance company should like, but as you pointed out at the top of the show, they want prices to go up.
Yeah, exactly.
Yeah.
Exactly. So there's really no incentive for them to do some of these things.
Right.
And interestingly enough, we had a coronary artery calcium score, I think it was in the fourth quarter of last year. And we had a number of people who went and saw that there was a significant buildup of plaque in their arteries. And, if they hadn't known that, they couldn't have made the lifestyle changes and some of the other changes they needed to make. They were probably headed in the direction of heart attacks. So these are $100 tests that, are very easy. It's a 15-minute test. It's $100 and it's great. A DEXA scan, for example, can tell you the visceral fat levels, which is actually way more important than, the fat around your waist. And people understand what visceral fat is now and how it impacts your health. And so we're trying to do a lot of things to educate our members on how to live healthier lifestyles, because ultimately I want our members to be in their 80s and thriving and playing pickleball with their kids, when they're 80 years old, or their grandkids, when they're 80 years old. That's ultimately what I'd like our members to do, because I think that's the true path to changing healthcare.
And that makes sense, because that also helps the community of the CrowdHealth community. Absolutely, because then you have less people that need to pull out money for their healthcare. So I know there's a handful of states that still require health insurance, traditional health insurance. So this is not a replacement for that, correct?
Yeah, there's 5 states. It's California, New Jersey, Massachusetts, Rhode Island, and Vermont, and then the Washington, D.C. all require health insurance. And if you don't have health insurance, then you get fined. And so, most of the time what our members are finding is that those fines are actually less than what they save by using CrowdHealth. Like I said, my family saved about $20,000 last year. I think for my family, my fine would have been like $2,000 or something. And so it definitely, is worthwhile taking a look. And we have actually a calculator on our sign up flow. If you try to sign up for CrowdHealth and you are in California, there's a little calculator down there that will show you or kind of direct you to the page on the California website to allow you to see what that fine is. And then you can just make a decision whether or not this makes sense for you. There's no federal mandate anymore. There's actually a federal mandate, but there's no fine associated with it. So in essence, there is no mandate. And so, people outside those 5 states don't worry about having health insurance. And 80 to 85% of our members don't have any health insurance, just CrowdHealth. And so that's what me and my family do. Just CrowdHealth, no other health insurance.
Yeah, I mean, it's definitely intriguing. I mean, I love what you're talking about. What about when it comes to prescriptions? Is there any inclusion of that, or do you have to do that on your own?
Yeah, I mean, prescriptions are for sure included. And in fact, we've got a couple of different resources for people to find really inexpensive prescriptions. We actually had a woman who had lymphoma, and her med was like $40,000 a month. And we were able to negotiate that down to $2,500 a month. And so we take a pretty active negotiation partnership with you. So if you were to go into the hospital, go to the ER, and you get this huge bill, we will actually negotiate that for you, so you don't have to negotiate it yourself. We have a team here that does that. And what we found is we can get these bills down by, oftentimes 70 or 80%, sometimes even higher than that, because we find errors in the bills. We find price gouging in these bills. And so we will take a pretty firm stance with the hospital or the provider and say, hey, look, this doesn't make any sense. You're trying to, charge exorbitant fees for something that, was a broken finger or something. And so we're really good at getting these bills negotiated down.
Yeah. So kind of walk me through it. So I'll give you a real example. I didn't break my arm. Instead, I fell off a ladder and I broke 6 ribs and punctured a hole in my lung.
Sorry
that was a couple months ago. I'm starting to feel better, but yeah, it was not great. It was not great. So, I'm getting bills as they come in. I'm very confused as to what's being paid and what's not. I don't really have a strong understanding of any of that stuff. So in a situation where, let's say I had CrowdHealth and not the traditional insurance that I currently have, how would I have used CrowdHealth? What would I have to do?
Yeah, so you fall off the ladder, you puncture your lung. Oh, it sounds terrible.
It was not fun.
Calling 911, or your spouse is taking you to the hospital. When you go to the hospital, you just say, hey, I'm a cash pay patient. They, by law, have to treat you the same way regardless. And every single ER doctor that I've talked to has no clue what kind of insurance you have, or none. So they have to treat you. You get out of the hospital, they start sending you bills. You go to the CrowdHealth app. When you get a bill in the mail, you just take a picture of it, and then we consolidate them all in the back end. We will then, once we have all of the bills, we will call the hospital on your behalf and start negotiating those bills. So let's just say, your punctured lung is, do you remember what it cost you at this point?
I don't. It's so confusing. I'm getting all these different bills. One for an X-ray here, one for an X-ray the next day, one for the hospital visit. Yeah, I don't remember what everything costs.
Yeah, you're probably going to be $30,000 or $40,000 in, is my guess. And so we'll take those bills, which are $30,000 or $40,000. We'll call the hospital. We'll negotiate those bills down. Let's just say we negotiate them down to $10,000. You'll pay the first $500, and so we'll go to 95 people ish, and we'll ask for $100. Those people will say yes. $100 will go from their account to your account. At the end of the day, you'll have $9,500 in your account plus your $500, which is $10,000. So then you can go and pay the hospital $10,000 directly. And typically that funding takes about a week. So it takes about a week for you to get your money. And so it's super, super easy. And you kind of know what's going on. We keep you posted. You don't get these explanation of benefits in the mail, which you're currently now getting, which don't make any sense.
I thought
the math doesn't even work on them.
No, it doesn't. It doesn't add up.
You're like, these are useless. Yeah. And let me tell you why this is happening. Healthcare is a business to business transaction. You, the patient, are not a part of that transaction. This is between a health insurance plan and a hospital. So they are not created for you to understand what they mean. In fact, if you don't know what they mean, that's better for the other two parties involved. Sure. They wanted you to stay out of it. I always say that, like, if you're not paying for the service, if you're not paying for the product, you are the product. And that's, in essence, is what's going on with healthcare, is they're making money, health insurance plan and the hospital, off of your sickness. You are the product in this equation. Sure. And so, that's just ultimately what it is. If you think of, like, if Apple or Google or somebody or Amazon were to have created that explanation of benefits, given we're paying for those products, it has to be really darn clear what I'm paying for, how much I paid, or else I'm going to be calling and being like, what's going on? You charge me too much. Healthcare, like, insurance company's going to figure it out, right? We'll just trust what they tell us. And so that's the craziness about our system, is that this is the only system where we get a bill in the mail and it can be for tens of thousands of dollars. And you're like, I have no idea. where this came from. So, that's the challenge with our system currently, because we just don't ultimately pay for it directly. With CrowdHealth, that changes. You're actually paying for it directly, but you're doing it with the help of 10,000 people who are helping you pay for this. So, that's the beauty of our system.
Do you see this, like, obviously you created a company, you want to scale, but do you think this could become the norm, this type of model?
I think I can. I think the big thing here is, like, there is such a big delta between what health insurance plans pay and what our members pay by paying directly. And in fact, our members are getting services for about half of what United Healthcare pays. So, that's a pretty big delta.
Yeah.
And so if we can figure out a way to do this for millions of people, which I think our current system allows for that actually. And we've got now hospitals and health systems who are actually on board because they hate dealing with the health insurance companies too. They hate the bureaucracy of it. When you have a deductible, the health insurance plan has to go after Kevin for the deductible. The hospital has to go after Kevin for the deductible. That's not the health insurance plan. And if the hospital doesn't get the deductible from Kevin, then the health insurance plan won't pay them for the other portion of what they're owed. And so the hospitals are like, what the heck? Would you just pay me directly? And so we talked to we have one of the biggest hospital systems in the country who are like, look, anybody who's a cash pay, patient, we'll give them exactly half of what United Healthcare pays for the exact same service. And this is one of the largest hospital systems in the country. So I think it's catching on. I think these hospital systems are interested in this. If the hospital systems are interested in this and the patients are interested in this, then we have both sides of that equation. And I think this really scales. So we're at 10,000 now. We expect to have about 20,000 members by the end of the year. And then we think we can double that every couple of years to get to a 100,000 level, which I think is, a real legitimate, player in this space. So that's our goal over the next couple of years.
Well, I can tell you might have 3 more by the end of the year.
Come join us.
Jeez, it's wild. It's really cool. Do you worry at all about government policy trying to stifle? Because obviously insurance, they've got some big lobbies.
Yeah, they do. They've got a lot of money.
Does that worry you at all as far as what could happen down the road as far as a different, depending on the party or the president or whatever, or the Congress that they could get, there could be some laws coming down?
Look, I can worry about things I can't control.
That's true.
And this is one I can't really control. And I firmly believe we've had multiple regulatory interventions already, which means that the State Department of Insurance have come to us and we've won every single time. And so I'm very confident in our standing under the existing law. I don't think under the current administration, the federal laws will change. Will some of the state laws change potentially? But if anything that reduces, if I can go after 49 states instead of 50, I still think we can make something that has, a significant impact. And I think the states that do allow the CrowdHealth to be used and they do see their prices going down, the states who are not allowing their citizens to use it are going to eventually be like, maybe we should allow them to use that. They're paying a lot less than what our people are paying. So, we've seen Uber do this. We've seen Tesla do this. We've seen Airbnb do this. It's actually call it regulatory entrepreneurship. And it's you play in this kind of gray space where, the regulations are very, shady, shades of gray. And so we're just trying to operate within that space as effectively as possible. And so far we've done a great job addressing all the issues that these regulatory agencies have.
Well, as I said, I'm fascinated. I think it's a heck of an idea and a great product, and I'm excited to see how it goes. The website is joincrowdhealth.com. Andy Schoonover, thanks so much for your time. I really appreciate it.
Thanks for having me.